Hello, this is Peter Jermain. Today is July 5th, 2020. Here are the notes that I will be using for this video. And the topic of today's discussion is going to be clinical anatomy. And I'm going to focus on the nervous system. Neurologists are physicians that diagnose and treat conditions of the nervous system. So this is the clinical specialty related to the nervous system. Whereas neurosurgeons treat conditions of the nervous system with surgery. So this is the corresponding surgical specialty. The brain is a prominent organ of the nervous system that is located in terms of anatomical direction. It's located superior to the heart, posterior to the eyes, inferior to the parietal lobes, and deep with respect to the epicranial aponeurosis. So these are some of the anatomical directions related to the location of the brain in the body. Prominent anatomical landmarks of the brain, which are biologically meaningful points that have correspondence among different people. So some of the anatomical landmarks of the brain could include the cerebellum, which is located in the back of the brain beneath the occipital lobes. It's separated from the cerebrum by the tentorium, and it helps to regulate motor movements. Another prominent anatomical landmark of the brain would be the medulla oblongata, which is located in the inferior brainstem, and it helps to relay signals from the rest of the body to the cerebral cortex of the brain. The lateral fissure is a very prominent feature. It is a deep sulcus in each of the hemispheres, separating the frontal and parietal lobes from the temporal lobe. Another prominent feature would be the longitudinal fissure, which is a deep groove that separates the two hemispheres of the brain. And finally, another prominent anatomical landmark would be the central sulcus, which is another fissure that separates the parietal lobe from the frontal lobe. So those are some of the important anatomical landmarks. And overall, the brain is the organ that serves as the center of the central nervous system. It's located in the head, and it ultimately exerts control over most of the activities of the body. For example, respiration, digestion. It helps to integrate and process information obtained by our sensory organs and coordinates the response. So that's going to conclude this video today, and I thank you for your attention.